Hey guys, Dr. Aaron Andrews here, PC Wellness Centers, Cape Girardeau, Missouri. Thanks for watching. So today I'm going to do a little bit different video. We're going to talk about autopsies. No, sorry, not the true crime autopsies I know a lot of you guys are a fan of. Me too, I like that stuff. No, we're going to talk specifically about the Winsor autopsies. Okay, and these are really cool. They've been around a long time. This research has been around a long time. I've known about it for 20 years. And I wanted to share it with you guys because it's very interesting. So this was done a long time ago. Henry Winsor, Dr. Winsor, was a medical doctor in Philadelphia. And he became very intrigued in his practice over the years when he would see that his patients, he kept seeing it over and over, that his patients, number one, were out of pain, but two, they were recovering from all of their organ diseases after they were being adjusted by a chiropractor or an osteopath. And it was, like I said, it intrigued him. He wanted to know. So he thought maybe there's some relationship between the spine and, the alignment and spinal health and the organs. And so he conducted a series of autopsies, 75 of them, okay? And what he searched out to find was a relationship, like I said, between spinal health and disease organs in that area, okay? So I want to touch on the anatomy again real quick. You guys know this, but here's the cervical spine, thoracic spine, and then the lumbar spine. You got 7, 12, and 5, okay? And then you've got the vertebra here and the nerves coming out. So these nerves obviously go to all your muscle, tendons, organs, and everything, all right? And so he did this research, okay? And I'm going to read it off here so I don't get them wrong. So he did 75 autopsies, and all 20 of them with heart disease. Every single one of them had misalignments in the T1 through the T5 area, okay? All 20. Stomach disease, all 9 that he found with stomach disease had misalignments again in the T5 through the T9 area, okay? Lung disease, all 26 with lung disease, again, in this upper back, T1 through T5, misalignments, spinal deviations. Liver disease, all 13 with liver disease had T5 through T9 misalignments. All 3 with pancreas, T5 through T9. Gallstones, kidney disease. I can keep going and going. The prostate, okay, prostate and bladder, all 8 cases had L1 through L3 misalignments. The uterus, all 2 cases of uterine conditions and disease had L2 misalignments, okay? So, to sum it up, there was a 100% correlation between minor curvatures of the spine and diseases of the internal organs. 100% of the time he found a disease in an organ had a misalignment in the corresponding nerve in the area of the spine, or degeneration or a misalignment, okay? All 100%. This is crazy, awesome, interesting research, and it has since been replicated tons and tons with the exact same findings, okay? When they do these autopsies, they find a diseased organ, they find an area in the spine that's misaligned, or the nerve is pinched, or there's arthritis in that area. 100% of the time. This is awesome research. I've known about it for a long time, but why don't you guys know about it? Okay, number one, I haven't done a video on it yet, but number two, there's factors that they don't want you to know about this, okay? But also, most people, for internal issues and organ issues, they go to their medical doctor and they go the medical model route and they get drugs and they get surgery, and that's absolutely fine, okay? You need that. You have to have that, all right? You have an internal issue, you have to have, go to an internal medicine specialist or a doctor or an MD and get the medicine and get the surgery, and that's fine. And we're very lucky to have some very good doctors around here. Matter of fact, me and Dr. Persley work really close with a couple docs around here that understand this relationship and are educated about this relationship with the organs in the spine that I just told you about. And they understand the importance of a multidisciplinary approach with a medical doctor and a chiropractor. And they see their patients happier, and they see, their patient satisfaction is through the roof, and the medicines that their patients have to take has come down a little bit because they are getting adjusted and they are getting treated by us along with them. So it's very, very important for a combination approach with your medical doctor and with us as chiropractors. And we see that every day, and we see that with the patients that are referred to us by these doctors. So, I want to also be very clear that chiropractic is not a cure-all, and chiropractic doesn't treat everything. And I don't treat these diseases. I don't market to them, or we don't say we treat them. Here's what we do as chiropractors. We obviously adjust the spine. People come into our office, they're in pain, they're hurting, they have numbness, tingling, burning, whatever kind of outside symptoms that they're having. And we adjust their spine, we fix their spine, we straighten everything up, and we increase the function. These nerves aren't pinched anymore. There's 100% power. And then wherever these nerves go, to a muscle, tendon, ligament, disc, joint, organ, heart, lung, wherever they end up, when there's 100% power, well, now everything, wherever they go, functions at 100%. And it heals themselves. Your body heals itself. So, like I said, we don't directly treat these conditions, but it's an indirect benefit of going to a chiropractor. Dr. Persley and I, we have patients all the time, that say, my neck's feeling really good, but my migraines are better. My sinus and allergies are better. Does that have something to do with you? Or my mid-back feels great. You got, those ribs don't hurt anymore, but I can breathe better, and my asthma's gone. I only need to use my inhaler half the time. Do you have something to do with that? Or my irritable bowel is a lot better, or my periods are more regular, or I've been trying to get pregnant for a long time, and I did last week after going to you for a couple weeks. Did you have something to do with that, doc? So we get these questions all the time. Not only are we taking care of people's pain and helping everybody function better and feel better, we're also helping the organs and everything else function better. So we get a lot of these crazy comments from patients about things that we are helping that we're not even trying to help, that we're just, like I said, indirectly helping by fixing the spine and improving the function of the spine. So chiropractic, in a nutshell, is very important for optimal health and should be part of everyone's health care. Okay, so if you have any of these problems that I talked about, and you're kind of excited about these findings, then give us a call, okay, or talk to your medical doctor about going to a chiropractor. Like I said, we work with some really, really great ones. If you have any questions, send us a message down here. We can answer your questions. If you know anyone with any of these conditions, or like I said, stuff we treat every day, pain, numbness, tingling, all that good stuff, send them in, tag them here, share this. This is some pretty cool stuff, the Winsor Autopsies. I appreciate you guys watching. Thank you very much. Go help somebody, and we have got your back. Thank you.